Hi, I'm Dr. Mike Brode.
Hi, I'm Jeff Saniak, and this is Asking for a Friend.
What does the most current research tell us about people who are more susceptible to long COVID? It's a great question. Two groups of people who are really developing long COVID. The first is, it seems people who are more predisposed to autoimmune disorders, usually younger people, women, and a group that was not hospitalized for the illness, who may have other kind of connective tissue disorders like Ehlers-Danlos syndrome, or autoimmunity that predisposes. The other group is people who were more sick when they initially got COVID. The group of people who were in the hospital are more predisposed to having longer symptoms. Okay, so what are the neurologic effects of long COVID? So the neurologic effects, unfortunately, there are a lot of them. Commonly, we're seeing headaches, we're seeing some people having nerve pain, but the one I think gets a lot of interest is that some people are describing what we call autonomic dysfunction. The autonomic nervous system is the automatic part of the nervous system that controls heart rate, blood pressure, temperature regulation, the movement of the gut. And those small fiber nerves can be injured from long COVID and affect all those systems. So, regulating blood pressure, regulating the heart rate, or having a lot of stomach issues because it's not moving properly. And we're really finding, especially with long COVID, seems predominantly to be a neurologic disorder.
What treatment options are available if I have long COVID symptoms? The disclaimer we always give in clinic is, while there's no currently recognized treatment, FDA-approved treatment, currently we're recommending we treat the symptoms because symptoms of fatigue, symptoms of anxiety, shortness of breath. We have medical treatments for these particular symptoms. We just try and keep in mind this paradigm of, generally we understand post-COVID, long COVID as a disease of inflammation, immune dysregulation, these things that we try and address in our treatments. But by and large, if you have shortness of breath with long COVID, we'd recommend albuterol inhalers, for example. If you have anxiety, we recommend counseling, exercise, antidepressant medications. So the treatments can really be varied and just kind of targeted to what you feel specifically.
And also too, our goal is to find targeted curative therapies, and that's why we're doing research with researchers at the University of Texas. But in the meantime, while we're still trying to find those targeted therapies, we have excellent symptomatic care and medications and lifestyle modifications we can make to help with this disease. Okay, so this is what do you tell skeptics who don't believe in long COVID? COVID-19 has been a humbling process for everybody in the United States, especially clinicians and scientists, and so we are not the masters of Mother Nature. And I think really, first of all, to the skeptics, we've seen over and over hundreds of patients telling us the same thing. They're having fatigue, they feel worse when they push through, they're having diffuse neurologic symptoms. Just because we can't explain it doesn't mean it's not real. And we're seeing the same thing over and over with patients, and so we absolutely believe them.
I would say, if there's one thing I could tell patients in addition, you're not alone. That's something where, we hear a lot, people coming in feeling like they've been invalidated before, and unfortunately it's more and more a recognized condition, long COVID. But people just, you need to know you're not alone in this. We're here to help, and just seek us out if you need us.
My asthma flared up to an intensity that I remembered in childhood. Will it go away? For long COVID, we're seeing people having a lot of persistent lung issues after their infection. Usually it can make their asthma worse, or they just feel short of breath and they never had that before. What we're seeing is it's a complex, and we don't quite understand it yet. For some people, asthma is really wheezing or constriction of their lungs. But for some people, when they walk, they just feel very short of breath, and that may not actually be a problem with their lung. It may be related to the fatigue or circulation and not actually a lung problem. And so the answer is a little bit of, yes, it can make asthma worse, but the breathlessness is not always asthma, although sometimes it feels like that. And we're just starting to understand it. How long after you have COVID will long COVID symptoms appear? A good question. It's variable for most people. The initial COVID-19 illness can last up until 4 weeks. That's when a lot of the symptoms will go away and then the healing process starts to slow. You know, we usually think people have long COVID when it's been lasting about 12 weeks or 3 months. People are slowly getting better over time. Usually though, people notice that their health is not improved after the initial illness and they've never fully recovered. Although there is a group of people, we call it they have a honeymoon period, where they go about a month feeling better before they start developing the long COVID symptoms. I think the thing I hear most talking with patients in our clinic is that the fatigue, the brain fog, and this term called post-exertional malaise, you do an activity that should not be tiring and it just wears you out. For a lot of people is long COVID and is the toughest part to deal with. And so while we don't have a cure for this, we have good ways of managing that, and a lot of that is focused on managing the energy, not pushing through, listening to your body, resting when you need it, and then of course talking to your doctor to see if there are other available treatments to help you with the recovery process.
We had a great time, answering all your questions today from social media. We would just like to take this time to remind everyone that, every patient is different. Any advice we give today is fairly general, and we still recommend obviously talking with your doctor about your particular symptoms or reaching out and scheduling an appointment with us in our post-COVID-19 program.
We hope you find these answers helpful. Once again, I'm Mike Brode.
And I'm Jeff Saniak, and thanks for joining us on Asking for a Friend.